article in the latest Journal of the American Medical Association is calling into question everything we've been taught about mammograms, who should get them, and when. Dr. Jennifer Walden is the clinical instructor of surgery specializing in breast surgery at New York's Langone Medical Center. She's here to tell us what this all means. Dr. Walden, thanks so much for being here. The New York Times ran an article last week that seems to change everything that we've been taught about when to get mammograms. Generally, as you know, they start when you're 40, and you're supposed to get them every single year until the end of your life, we've always been told. But here's the bombshell. And this is according to Dr. Laura Esserman. She's a breast surgeon at the University of California. Let me read for everyone what this said in the new article. Women over 70 or 75 can stop being screened because no studies have shown that it helps them. Evidence was also lacking for a benefit in screening women from 40 years old to 50 unless they have a strong family history of breast cancer or a mutation in the gene called BRCA, which greatly increases the risk. We don't have to get them until after 50 now?
Well, these researchers have raised the debate that the incidence of breast cancer has gone up with early screening and mammograms, but the incidence of late-stage cancers has not declined. And so the American Cancer Society comes out and then says, we've overstated the benefits of screening mammography, and people are being overdiagnosed and overtreated, and we're missing some deadly cancers. So Dr. Esserman is basically saying that this test needs to be perfected so that we can pick up more of those deadly cancers and not overtreat women. Now, people that are older than 70 generally have slow-growing tumors that aren't going to be the cause of their death. So she's saying maybe not every year for those ladies. And people that are under 50 are getting overtreated, a lot of biopsies, and they aren't going to have the rate of breast cancer that people in that age of 50 to 70 have, where we know there's a real benefit to screening mammography.
Okay, so are you saying for everyone listening out there right now who is under 50 years old, they can stop getting the annual mammograms?
No, now I wouldn't say that right now. My mom's life was saved by a screening mammogram from one year to the next.
How old was she?
She was in her late 60s, so she fell in that group. But basically, while we're perfecting this screening program and looking for more sophisticated ways to define tumor biology, like what tumor is going to be aggressive and what's going to be slow, which we don't know right now, so we have to treat breast cancer when we find it. Well, in that case, we need to continue to do mammography as the American Cancer Society has recommended, because if you do, it lowers your chances of dying of breast cancer by 24%. Breast cancer basically can kill people, and screening mammography saves over 1,000 lives every year. So
but are we exposing women who are 40 to 50 who may not be served by it to too much radiation right now?
The radiation is a small factor, but a lot of it is over-treating and doing more surgery and more biopsies than is needed in this age group, and the psychological angst of getting followed and re-mammogrammed every 6 months or every 1 year once you get a certain classification on your mammogram. And that's where we can become more sophisticated with our screening programs.
All right, so it sounds like what you're telling women who are listening right now, we need to end on this, is that don't change anything yet. Keep an ear to the ground for the changes and talk to your doctor.
Exactly. And evaluate your own risk. Are you postmenopausal and taking hormones? Have you had children late in life? Do you have a family history of breast cancer? And do you have dense breasts? And those factors should only be analyzed between an individual and her treating physician.
All right, Dr. Jennifer Walden, thanks for coming in to explain all this to us.